The first time since the pandemic began, Tufts Medical Center is reporting 0 COVID-19 patients in their ICU. The hospital admitted their first COVID patient 731 days ago, March 23, 2020. And as of today, the hospital is caring for 9 COVID patients, but none of them are in serious enough condition for intensive care. I asked Dr. Shira Doron what she thinks about this milestone.
It's a cautious optimism, obviously, because it could change in a minute. But it's a moment, I think, to pay attention to, because even though we are so much more cautiously optimistic, we know that when we're in these periods of low cases and low hospitalizations, they can be transient. Mm-hmm. We know that cases can rise, hospitalizations can rise. We certainly learned our lesson when we were so optimistic a year ago, last spring, and then Delta happened and then Omicron happened. But we are in a different place. You know, having this be the first time without ICU patients since March 23rd, 2020, means that we are in a different place where cases might rise, but don't necessarily always mean that ICU admissions will rise, where we have vaccines and boosters and treatments and more testing and, unfortunately, a wall of immunity from natural infection that was so huge from the Omicron wave that will protect people for at least some time going forward. So this is a time to actually enjoy it, knowing that it may be short-lived.
Feels good to hear you say that. Well, one other quick question, as people hear about the subvariant of Omicron, and, you know, at least the good news, if we can call it that, is it's clearly more contagious, but less severe, right? Just for the layperson, is it true that we should kind of be, you know, optimistic looking at the future, that the mRNA vaccine technology developed so miraculously for coronavirus, as different variants come about, will that technology allow doctors to tweak the formula so that it can combat each new variant?
Well, on the one hand, yes, the mRNA technology does lend itself to being adjusted to the current variant. On the other hand, what we've seen is that the companies do respond to the variants. Beta was the first one that was very evasive of the immunity from vaccination and actually never became an issue in the United States.
Right.
By the time they're done tweaking it, sometimes the emergency is over. So, but if the emergency were to persist, we could quite easily have a new vaccine, and the FDA is actually meeting, the FDA's advisory panel is actually meeting to discuss that very issue on April 6th.
Oh, good.
mRNA technology has been amazing. We aren't done, though. It isn't perfect, and I think we could do better. And so we certainly need to have continued drug development in that area to make sure that we are working on vaccines that are more durable over time and actually prevent infection and not just severe disease. So there's a lot of work to do, but certainly they exceeded all expectations out of the gate. And they helped us through pretty difficult times.
Incredible.
You know, I think that BA2 is here. I know BA2 is here. We know that BA2 is here. And in fact, in our region, in the New England region, it is likely the predominant strain already. The CDC is estimating over 50% in the New England region. Over 50% of new infections are due to BA2. We had heard from the Massachusetts Department of Public Health, we were over 50% a week ago. So it is likely the predominant strain right now. The fact that we are not seeing rapidly rising cases, hospitalizations, wastewater levels rapidly rising is a good sign. It doesn't mean that it won't, but there have been some gradual increases in wastewater levels that don't look anything like the rapid rise that we saw when BA1 or Omicron came on.
Those peaks used to give us heart attacks, right?
Right.
Good.